Okay, ma'am, I'm ready.
Both are ready?
No, I'm not yet.
Okay, great.
Okay, I'm ready.
All right, so if you've read and understood, considering it has taking station, please begin.
Okay. Hello, my name is Ofyong. I'm one of the surgical doctors. Please, may I confirm that you're Mrs. X and you're 68 years old?
Hello, I'm Miss Lamia, 68-year-old.
Oh, nice to meet you, Mrs. Damia. Okay, I understand that you're here in preparation for your total hip replacement, and I'm here to ask you some questions concerning your health. Can I go ahead, please?
Yes,
Okay, Mrs. Damian, can you tell me when did you start experiencing your hip problems?
4 years ago.
Okay, can you tell me which particular hip? Is it the left or the right, just to confirm?
I have pain in my left hip.
Right hip. Okay, so sorry. And then, can you tell me the character of the pain? Is it a sharp pain? Is it a dull pain?
I feel like something is stabbing me.
Okay, and now does it move anywhere, or it just stays in your hip?
It just stay in its place.
Okay, and is it always there, or it comes and it goes sometimes?
It's always there.
Oh, so sorry to hear about that. And then on a scale of 1 to 10, 10 being the worst pain and 1 being the low pain, where would you grade your pain?
It's 9.
Oh, that must be very frustrating for you. Do you mind if I give you some painkillers before we can continue?
No, carry on, doctor.
Okay, all right. Okay. Have you ever been diagnosed with any medical condition or you've seen your GP for?
Thank you for your question. Yes, I have a lot of disease. I have
Okay.
diabetes and hypertension and asthma, and I have a heart problem.
Okay. Okay. So for the diabetes, when were you diagnosed? How long now?
What?
For the diabetes, when were you
What
diagnosed?
do you
How,
ask? 2 years, 2 years ago.
okay. Are you taking any medication for it?
I take metformin only.
Okay. Is it controlled with just metformin with your GP?
Yes,
Okay. Okay. For the hypertension, how long ago were you diagnosed with it?
also 2 years ago.
Okay. And are you taking any medication for that too?
I take lisinopril.
Okay. And is it under control?
Yes, it's controlled.
Okay. And then you made mention you're also asthmatic. Are you taking any medication for that?
No.
Okay. Can you tell me when was the last severe crisis you had? Asthma episode you had?
What do you mean by CVA?
Like the severe asthma that led to you being admitted.
I can't hear you.
Can you hear me? I said, when was the last episode of severe asthma crisis you had that resulted in you being admitted?
Crisis of asthma, you mean?
Yes, yes.
Yes.
2 years ago.
Okay. Do you use any inhaler? Do you take any steroids, medication?
No. No.
Okay. Okay. You made mention of heart problems. Can you tell me what was it? What were you told?
It was angina.
Okay. Okay. How long ago was this?
1 year ago.
Okay. And were you managed? Where did you go to the hospital?
Yes, I do a surgery, but I'm not really remember it.
Okay. Okay. Now, is there any medications you're taking apart from the ones you told me that was prescribed?
I taking warfarin.
Okay, okay. Do you have any allergy to any medication?
No,
Okay, and then you made mention you had a surgery. Was it a heart surgery, and when was it?
I have a surgery 1 year ago when I have my angina.
Okay,
I also do many surgery. I do appendectomy, and
okay,
also I do a breast surgery 2 years
okay,
ago.
okay,
And also I have a lung problem. I do a surgery also in my lung.
okay.
Those
Okay,
things.
thank you very much for this information. I'm going to be asking you a lot more personal questions. Is that okay by you?
Yes.
Okay, do you smoke?
No.
Okay, do you take alcohol?
No.
Okay, well, who do you live with?
Occasionally, I take it occasionally.
Occasionally, okay. Who do you live with?
My family.
Okay, then you said you had many surgeries. You mentioned the surgeries to me. Have you had any problems with anesthesia, with the medications?
No.
Okay, okay. Can you tell me how has these hip problems affected your life generally? Do you use any walking aid?
Thank you for asking me this question, doctor. When I have this pain, I can't do my job. I stay in the bed. I don't go to the work.
Oh, so sorry to hear about this. Don't worry. You're just in the right place, and we are
I'm
preparing
very
for.
afraid. I'm very afraid because I'm the one who giving support to my family.
Okay,
Could
I
you
understand.
please summarize your history now?
Okay, my patient is a 68-year-old lady who came to the clinic today for pre-operative assessment for total hip replacement with complaints of right hip pain for 4 years now. It's 9/10 in severity. It's non-radiating and with many comorbidities. He's diabetic, taking for 1 year now, and taking metformin, well controlled. He's also hypertensive for also 1 year now, taking lisinopril, and he's also asthmatic, and he's not on any steroid or any or inhalers. The last crisis he had was about a year ago, and she's also on warfarin, and has had many surgeries, has had an appendectomy, has had the mastectomy, and lung surgeries also.
Okay. So considering the history that you have taken, do you consider this patient to be fit for the elective total hip replacement which is planned?
Okay, no, I don't consider her yet because we need the patient has so many comorbidities, and we need proper preoperative optimization.
All right.
Um,
Okay.
okay,
How do you plan to manage this patient?
okay, first of all, I would like to discuss the patient and the anticipated surgery with a multidisciplinary team, which will include a cardiologist for the hypertension and the angina and the previous heart surgeries that she has had, and a pulmonologist for the asthma, and also consult with the hematologist on the warfarin that she is also taking. And then I'll also like to do some baseline investigations, which will include full blood count to look out for hemoglobin level and white cell count and inflammatory markers like ESR, CRP. I also like to do baseline investigations in preparation for surgery like open and cross matching, liver function tests, electrolyte and creatinine.
Okay.
And
further?
Chest X-ray and ECG for
Right.
the heart problem and the hypertension.
Yes. Anything else?
Okay.
Considering that patient is having recurrent angina,
Okay.
you'll refer the patient to cardiologist. And since the patient is asthmatic, so you'll also refer the patient to respiratory physician. Right. And then if the examination, the physical examination was concerning, you'll ask for the spine X-ray. And why would you ask for atrial duplex scan of the lower limbs? What would you suspect?
Okay, to rule out claudication,
Okay,
peripheral vascular disease,
right.
or vascular claudication.
Okay. Has patient given you any history of lower limb swelling or anything? Or
No,
pain?
because the patient is a known hypertensive and diabetic, which is a risk factor for atherosclerosis.
Yes, and
And
patient is not so much mobile,
okay.
sedentary patient. So, and there is a hypercoagulable state as well.
Yes.
Yes. So there is possibility that thrombosis
Different.
event could occur. Good. Thank you.